My name is Andrea, Texas, and before I get into the bulk of my presentation, I'll just tell you a little bit about myself. I started my career in research. I graduated from University of British Columbia in experimental medicine program, and I got a job at STEMCELL. And I was a research associate for a couple of years. I was working in development of products for mammary, then prostate, and pluripotent stem cell research. And so during that time, I developed these products. Actually, these are the ones that are still alive. A few of them didn't quite make it the 10 years, but that's okay. And so a lot of my days were focused on harvesting tissues, dissociating them into single cells, selecting the cells of interest, plating them down, culturing them, and so on. And that was a lot of fun. I mean, academic labs are not all that different from industry labs, and so everything that you can imagine basically happened in there too. But then once in a while, I was invited to take part in stem cell training courses that our education department is offering. And that, for me, comparatively, was a lot more exciting. I was able to spend a couple of days with people who would come and basically learn from us. And that couple of days of hands-on training meant that some of the technical hurdles that they've had were overcome or close to being overcome. So the skills that I was kind of taking for granted every day, they were actually finding them very useful. And then they would go back to their own labs, and they would teach the people in their own labs, and maybe the new generations of students. And so the investment of that time with 10 people would result in maybe 100 people being trained over time. And the impact of that was quite staggering for me. And that was just a single cohort, and we were doing these all the time. So that's me in 2009. So in 2009, actually, I was given an opportunity to focus a lot more on that help aspect and enable science through knowledge sharing. I was given an opportunity to become a product manager within the marketing department and essentially support the products that I developed in the lab. And I was very excited. All of a sudden, my audience was not hundreds of people, but perhaps tens of thousands of people. And I was able to develop scientific content that would be of interest to them. And then more recently, I'm focusing on some of the bigger ideas that point to challenges in life sciences. And so that brings me to my topic of today and the integrity in marketing. So let me ask you this question. How do you really feel about marketing? Do you feel that vendors promote products with honesty, or do you feel that marketers, such as me, sometimes take creative liberties to describe products a bit better than they actually are? And some of you are smiling in the audience. You don't have to answer this question. I think all of us understand that the majority of marketing materials end up in the garbage. I think most people believe that marketing sometimes inflates claims, and that companies are all too focused on the profits to really be unbiased in their assessment of the reality of the quality of their products, or perhaps even in presentation of that reality. The only difference is that we are not, in life sciences, catering to a general audience. We're scientists, and we're catering to scientists. And scientists, by definition, are skeptics. And I'm looking at some of you in the audience with your arms crossed. You know what I'm talking about. So why would scientists tolerate anything but the absolute honesty in any scientific claims? Why would it be okay for marketing to perhaps highlight cherry-pick data, and your work has to be scrutinized for months in the peer review process? And we agree. I don't think that should be the case. And STEMCELL, in fact, wanted to make a stance on this. So last year, around this time, we decided to put one of our claims up for a peer review. We claim that we are scientists helping scientists, and we decided to put that to a test. So in January of last year, we put a call out to scientists all around the world to come and peer review us as scientists helping scientists. So we created a bunch of social media ads. We emailed our entire audience, and more than 300 people actually applied to be a part of this experience. They wrote very insightful applications, and we reviewed all of them very carefully. We wanted to select people that really understood the intent behind this initiative. And we wanted to also select those that would be unbiased. So we selected against those that were collaborators in the past or that are currently in some sort of a partnership with us. And we also selected against the people who expressed interest in becoming employed by us. So on those two parameters, we tried to set ourselves up for success. So these are the people that we selected: Dr. Amy Stone, Dr. Craig Eyre, and Dr. Fiona Frame, all postdoctoral fellows coming to us from 3 different countries. And in April 2018, they landed in Vancouver, and over the following couple of days, they spent time touring our facilities and chatting with our staff. We broadly covered the following topics, so product development and marketing, process development and manufacturing, quality management system, product and scientific support, and scientific communication and sales. Their tour was completely unscripted, so we had a rough schedule for them, but they had the ability to change the schedule or invite others into a conversation. They were allowed to ask us almost any question except for those that are pertaining to our intellectual property. They even sat down with our founder, Dr. Alan Eves, who's our CEO, and they talked about the history of STEMCELL and some of our future directions. And so it was a very exciting process. We had cameras, kind of like the cameras that you see today, to follow us around. And it was a bit of a reality TV experience for them, which we then condensed into a 10-minute documentary, which they've also reviewed and made sure that it was actually representative of what had taken place. So their verdict was accept with minor revisions against our claim that we're scientists helping scientists. So they were not exactly thrilled with everything that they'd seen, but they liked us enough. And they also made some interesting recommendations for us for the future. But I think what was more important is that they felt that we've allowed this peer review to take place in a transparent manner and with a lot of integrity. By the way, this video is available online, so if you Google peer review and STEMCELL, or if you YouTube it, you're going to see it among the first few hits. This is what Dr. Eyre actually reflected during his podcast interview. We've spoken to more people than I can remember. We've been in every department. We've been top to bottom, and they've been very welcoming to talk about what they find frustrating, what they find exciting, what they want to do, and the conversations they want to have. They're trying to engage us as peers and as scientists instead of as their customers. What they also came out with is that intrinsic value that is a part of all products that goes beyond the list of components. And I think that's what Dr. Fiona Frame reflected in her comment, that what I've had from here is an appreciation of the amount of work that goes into a company to produce something. It gives me ideas of how I can hold other companies to account, to the accountability of their practices and their quality control. So obviously you guys have not been a part of that experience, but we wanted to share with you some of the questions that we think and that our peer reviewers felt should be important to consider when you're reviewing, for example, marketing materials. So let's say you're given a product flyer. These are the things that may come to mind. How are you testing product performance? This is the same way that I would test your product performance. Under what conditions do your product fail? And let me be clear, all products fail under certain conditions, especially if you tinker with them. So if you're planning to tinker with them, have that conversations with your providers, because the chances are they may have actually done those experiments and they may not have worked. How will you support me if the experiment does not work? And that goes beyond the simple product replacement that most companies would do. Have you had any recalls, if that's important to you? If so, how many and when? What is your batch-to-batch variability? And more importantly, what is for you an acceptable level of variability between batches? Because that could also be an impact on your experiments. Can I see your raw data supporting the claims about the superiority of your products? And within that, did you test the competitor products? How closely were you following the competitor protocol? Did the experiments work? And did you troubleshoot if they did not? With this, I'm not advocating for heroic efforts on behalf of companies to do every experiment possible. I think there's realities about the type of investment that you want to make in those types of activities. What I'm advocating for is transparency about the experiments that were done. Don't overinflate the claims. We don't know how much of that is happening, but there is certainly a perception among consumers that it is, and so that's what we're trying to fix. So what you can do as our academic audience is basically make sure that you hold us accountable for the claims that we make in the marketing materials. Scientific claims are scientific claims no matter where they're listed. Thank you.